Oh, oh, I am so sick of this. Honey, honey, would you please help me tie my shoes?
I can, but why don't you go see Dr. Kriss so we don't have this problem anymore?
All right, help me into the truck, okay?
You know, low back pain is no laughing matter. In 1979, when I was first considering a career in chiropractic, I found a study that the University of Wisconsin did comparing the effectiveness of treating low back pain, chiropractic care to medical care, only to find out that chiropractors excelled in getting patients better, faster, back to work cheaper, with happier patients and a longer lasting recovery. So unless you like taking toxic medications that interfere with the way you think, strong muscle relaxers, or somebody taking a big pipe and jamming in your back, shooting you up full of cortisone. And by the way, did you ever wonder why they only let you have 3 of those shots? Which is only temporary relief at best. So if I were you, and if I were considering surgery or having one of those cortisone injections, I would find out what they want to put in you. Go to the internet, click search, and find out all about it. Chances are very high it will change your thoughts on the effectiveness and the logic of medical care for your low back condition. People often ask me, how come my medical doctor didn't tell me that? Well, you know, they're smart guys with great hearts, and they have the capability to recommend very powerful drugs that will make you feel a lot better. But their area of specialty is infections, tumors, you know, cuts, stuff like that. Not treating disorders of your spine. That is my specialty. So first, let me help you to understand what we do, what the problem is and what we can do to help you with your low back condition using this tricky chart that was written probably sometime in the 60s or even earlier. But the findings of those days are as accurate then as they are now. This is a picture of somebody's low back from the side, your sacrum or tailbone. This is the L5-S1 disc and the body of L5 and L4 disc and L5. And here you can see the nerve root, and the disc is usually on an x-ray about 10 or 12 millimeters thick. And then here you can see this is all swollen and inflamed. They call this all kinds of terms. They call it a ruptured disc, a herniated disc, a sequestered disc, a prolapsed disc. I've heard so many terms over the years I don't know what's what anymore. But all I know is that when this disc herniates like this and it starts to pinch on a nerve, it hurts really bad. When you come in as a new patient and I show you the spine sometimes, what I do is I explain to you what it is, but then I say, okay, stick your finger in this hole. And then I misalign the vertebra and have you smash on your finger. And every once in a while, I hear people shaking, ah! Well, as much as that hurts, it does not hurt as good as a good solid nerve pain. Have you ever been to the dentist and have them drill a hole in your teeth and then to find out if it's right for filling it, they just take the little probe and they pinch in the nerve? Yes, you know that feeling. Talk about pain. A good nerve pain is about as bad as it gets. I've had patients compare the pain of their low back pain to the pain of childbirth, to the pain of a broken bones, and those pains at least can be taken care of with the use of medications. A good solid nerve pain, nothing can hurt sometimes just short of knocking you out. Anyway, when a disc herniates or bulges or swells like this and starts to pinch in the nerve, you are in big pain. I understand that, and that is absolutely no fun to you probably, because since you can't work, you can't get around, can't tie your shoes, which by the way, I know I've got a bad low back when I come in with a pair of slippers on. But anyway, I mean, those are just some of the effects. Low back pain is the #1 reason why people miss work, as an example. And to the license, or not the licensing, the companies like the Department of Labor and Industries, low back pain is probably their biggest diagnosis, other than like I cut myself working on a piece of metal. Well, anyway, but what I mean by there's more is, even though the symptoms of this may go away with you taking big medications, do the things that you do, and stretching and rolling and dicing and all the other stuff, usually your condition will continue to progress and worsen. The disc will continue to deteriorate as it goes through these phases of degeneration here. until it's already in a very weakened state. Excuse me. And what generally happens is when people come in for their problem, it's not because I lifted a 100-pound thing and I hurt my back. Sometimes it is. But what it usually happens is all I did is I bent over to pick up a nickel and whammo. Next thing you know, I got this big pain. Well, as I just said, the misalignment of your spine probably happened several years ago. It's been weakening, however asymptomatic. And then it turned into subluxation, which means then it shifted a place just enough to pinch in a nerve really hard. So you probably don't have an acute condition, meaning brand new. It's probably chronic, which means it's been progressing for a long period of time. And as far as treatment goes, the first thing that we do is ice. This is a great natural anti-inflammatory that can be local to exactly where it's swollen. Did you ever think when you take an anti-inflammatory, it's not so smart that it knows, hey, go to your low back. It treats your whole body. And if you use ice, it goes on just to where you put it. That is the greatest anti-inflammatory, plus it'll prepare your spine so when we go to make an adjustment to your spine, it'll feel better and work better, usually quickly. Not only that, but some people say, oh, this hurts so bad, there's no way I'm gonna let you mess with my spine. Well, I got to admit, if I hurt bad like that, I would be a little hesitant too, but I want to point out two facts. First, I got 26 years of experience in doing this. I know how to do this and not hurt people. As much as you don't want to be hurt, that's as much as I don't want to hurt you. And to the best of my knowledge, I've never done an adjustment to somebody and tore them up so bad, sent them off to hospital, had them in surgery. If that has happened, I don't know about it, but if it is, it's not very common at least. Most of the time, if you're able to ice it and I make a good adjustment right away, you'll probably be feeling a little bit better. And what do I do to make an adjustment? I very easily, through whatever tools that I can, usually physically, meaning I actually move it back into place just a little bit. I don't work to manipulate your whole spine and get the correct. You know, that's not what you need when you hurt really bad. You just need a little bit of nudge. And when you get up and say, oh, I feel a little better, I am done for the day. Now, relief is important, but what's also most important is that we continue care to correct the underlying disc deterioration that you may have down there. Because until this is restored to its fullest, both by adjustments and changing your lifestyle habits and doing certain specific exercises, this has a very, very good possibility that it can be corrected to its fullest. Will it always go away and be perfect? Will we fix you forever? Well, I would like to say that we could fix you forever, but chances are we can't. But what's your other option? Take drugs and medications for the rest of your life with increasing frequency and increasing intensity of the medications? How much is that going to cost you if you add up those Doan's pills 3 times a day, 7 days a week, 52 weeks a year for all the rest of the years of your life? That's not cheap either. Anyway, this is the fastest, hottest thing going. So if you have any questions on if we can help you, click right there. Schedule an appointment. You have our email address. You have our telephone number. You can call us. You can fax us. You can email us. You can just show up here and we will get you in, because my purpose in life is to help you get rid of these things. Thanks for your attention. Hope we see you soon.